Welcome to the Idaho Main Street Podcast, where we talk about the issues that matter to you. Welcome to the Idaho Main Street Podcast. Today, it's a healthcare day. We are joined with the Vice President of Government Relations, a legend in Idaho, an expert when it comes to healthcare. I'm setting the standard high for you. Toni joining us with, 25 years of experience in advocacy, dealing with policymakers when it comes to healthcare. Toni, we really appreciate your time joining us today.
Thanks. I'm happy to join you. Wish I could be there with you in person, but it's a busy time.
I know. Hard to get you out of Ada County when there's just so much going on over there. But we're going to steal you one of these days and get you over on this side of the state.
I'd be happy to come over.
All right. So you probably aren't aware, but there was an election that happened recently, and it seems like there's some things that happened there. You spent some time in D.C. working on the Senate side and dealing with healthcare policies with the committee related to aging as well as veteran affairs. As you have experienced D.C. and healthcare policy making or the lack thereof, what kind of context can you offer us as you look at the results of the election and what appears to be a single party control in the House, the Senate, and the White House?
It's going to be really interesting. I think, since I was there, things have changed pretty dramatically. I would say some would find it hard to believe, but that Congress is a little even less functional now than when I was there. And it seems to be there's just even less desire to work together. And they spend less time going through the natural processes of the legislative process to pass bills, to do things. So I think with this election, we're going to see if, the Republicans now in control of the House and Senate, they've got some big decisions to make. There's still a lot of things on the to-do list during this lame duck session. They'll go back on the 12th, if I remember correctly, and start their lame duck session, but they still have to look at funding for the fiscal year. They still have to look at whether or not they're going to continue with another continuing resolution after December 20th. Whether or not they're going to do some kind of omnibus package, I'm not sure if there's agreement between the president and leadership in Congress on whether or not they should do an omnibus package. That's something people I think should really be looking at. And we're going to look at potentially all kinds of changes to healthcare, all kinds of things on the table. Cuts to physician payments that are about to run out, that prior to this time, we've kind of been avoiding those cuts. Congress has taken action each time. It's time to make those cuts. I don't know if that will happen again. We're looking at potential cuts to rural programs. So a lot could really happen depending on, in this lame duck, do they decide to take action, do some kind of omnibus, or do they kick the can down the road till next year when they have the president in place and the majority in the House and Senate?
Right. Because if you're a Republican, you're saying, hey, we don't want to enact more of a Biden budget, and you want to change it up. But at the same time, Republicans aren't really in control from now till the end of the year, and funding things, it's a necessity and it's going to happen. So this does feel like it might be a perfect storm brewing when it comes to getting some government funds passed.
And it's still their job, regardless of who the president is. They're supposed to pass budgets. Sometimes they forget that, it seems, but that still is their job, regardless of who's in the White House. And they have some big bills that either need to be passed or reauthorized. There's a $15 million supplemental to deal with the hurricane, the results of the hurricane. That can't wait, probably. Even both sides are going to want to take action on that. There's the defense bill, there's the farm bill reauthorization. So I think there's still a lot to do. It's just going to be, do they do a continuing resolution and wait to January to take action on those issues? Or can they get some things done and maybe start with a little bit of a clean slate in January?
Yeah. One thing I've noticed when it comes, like, Republicans naturally tend to be more they tend to go rogue more. They don't fall in line with their speaker as well. We can look at the 17 rounds to get Speaker McCarthy in and then booted a little while later. Whereas Democrats tend to listen to their leader. They're naturally more collaborative, and just by nature of the beast, the Republicans are a little more independent minded and little can go out there. The concern that a lot of people say is, when Democrats control all three functions of government, they get so much stuff done, and it scares conservatives. But when conservatives control all three, they just kind of fight amongst themselves and aren't able to get things done. And I mean, do you any
Senator, a longtime serving senator who one time told me Republicans are really good in the minority. They're really good at directing from the minority. But then when they gain control, it's harder to keep them in line and get things done.
Yeah, that's really well put. And it's one of the reasons why a lot of people love Republicans is their, ability to buck the system, fight the establishment, get things done. But when it comes time to get things done. Anyways, just a note to our listeners you heard it here from Toni and I first, that this could be a wild ride as we buckle up and see what can get done from now till the end of the year.
Well, and a big part of that is going to be one thing that has changed dramatically for Idaho is our influence with Senator Crapo now being ready to come in as the finance chair. That is a very powerful role, and that's going to give Idaho a place of prominence that we haven't had in the past. And I think everyone is going to be knocking on Senator Crapo's door, wanting his help with things. So it's going to put Idaho in a different position than we have been in the past.
And industry wide, right? Anybody who's looking from Idaho getting some advocacy, Senator Crapo in the finance chair, perfect point. You also look at now Senator Risch has been elevated yet again as one of the most influential senators when it comes to foreign policy, and somebody that will undoubtedly have the president's ear. On the House side, Congressman Fulcher now has even more experience than Congressman Simpson will now be a cardinal, as they refer to him, on the Appropriations Committee. So Idaho consistently is punching above their weight whenever we're in the majority. That's pretty good. Now then, let's talk ACA on the national front. Do you see any moves happening there? The concern or the excitement is repeal it? Any predictions?
I don't think you can call me on this later and tell me how wrong I was. But I don't anticipate we're going to see a broad repeal of the ACA. I think we saw the last time around, it was a pretty difficult lift, regardless of the majority. But what I do anticipate is a pretty big package of ways to change it dramatically, maybe cut programs, maybe implement work requirements for Medicaid, cut a lot of supplemental spending that takes place under the ACA. And I think these are things we have to really watch carefully, because a state like Idaho, if some of those rural programs get cut, that could have a kind of disproportionate impact on a state like Idaho than to some other states. So I'm hearing a lot around, different things on drug programs and a lot about requirements for Medicaid, work requirements and other requirements that would make it more difficult or make Medicaid enrollees have more skin in the game, depending how you want to look at it.
Yeah, that makes sense. And it's a good point that when the cookie cutter solutions sometimes come out of the Capitol, they work really well for big cities. But then when you try to put them into rural Idaho, it can be crippling. So let's leave DC aside for a second and come specific to Idaho. How would you describe the state of healthcare or how your hospitals are doing in the Gem State?
It's a little tenuous right now. Last year we did a presentation to the legislature, and we had the theme of the game Jenga, where you can, take out one piece and the tower's fine. You take out another piece and the tower's fine. And suddenly you take out that last piece and the tower collapses. We're still in a pretty precarious situation for a lot of our hospitals in Idaho. We're starting to see a little more stability after COVID and after severe workforce shortages. We still have very definite workforce shortages, but for a while our hospitals were dependent on traveling nurses and traveling providers that we had to bring into the state from out of state and pay double and triple what you would normally pay. So that has stabilized somewhat. Um, some of our folks are in a little more stable position. Our small hospitals, a significant portion of them are still just right on the edge. They're either operating in the red or operating with a 1, maybe 2% margin. But we still have far too many hospitals operating in the red right now.
So we've talked to Representative Wheeler a few times about his work in trying to attract doctors here and what he can do to cut some unnecessary regulations to be able to make it work better for those who can be trained here and stay here. Is that type of policy going to be enough, or is it just a step in the right direction?
We kind of have an approach here of all of the above. That's one thing that can help. Loan forgiveness for rural doctors and rural nurses is one thing that can help. It's not the answer to the problem. A few nurses here and there are going to make a big impact here and there, but it's not going to, solve our problems across the state. And the other big thing that we're running into is just inability to recruit to Idaho. With some of the laws that have taken place in Idaho, some of the laws that criminalize physicians in particular, if they break the law or if they get sued, that's not attractive to providers. And we're in a state that already had difficulty recruiting to the state. Anything that tips the scale, makes it even a little more difficult or makes their license a little more vulnerable or puts them in a position of being criminalized for providing care they think is necessary to a patient, makes it that much more difficult for us to recruit to Idaho. Almost all of our hospitals right now are having difficulty recruiting OBGYNs, maternal fetal specialists. We've lost over 22%, I think, of OBGYNs in Idaho in the last couple years. So it's another one of those things. While we need all of the above to solve the problem, all of these separate pieces of legislation and separate policy decisions are adding to the problem.
So, in policies like typically on the Main Street podcast, we pride ourselves on the nuance, right? Where everywhere else goes into the very black and white issues, and it's either this or it's that. We say, a lot of things operate in nuance. I'm almost going to contradict that today, and I had no intention of getting this blunt when it comes to this issue, but I would love, because you represent the hospitals, you have a front row seat, and you deal with these doctors every day. I'd love to just get the cold hard facts, because my dad, who was living in Phoenix during the election season, is saying, hey, they bombarded us with messaging that these doctors are letting women die and that these doctors are going to get thrown in prison. And it seemed very much like a campaign tactic to try to win some seats. And he very much felt it was such as communicated to me. But then, you have doctors who are communicating to you that this is problematic. So please help us understand the laws, particularly in Idaho, related to abortion. What do those mean when it comes to the vulnerability of a doctor being sued or being prosecuted? And what does that mean in just the terms of the messaging or the signal? Just give us the facts here so that we don't have to worry about being spun for any political reasons, but all of our listeners can know, okay, that's the fact, and now I know where we're at with these laws and our doctors. Is that fair, Toni?
Yeah, no. And no matter what the reason, the clear fact is we're having trouble recruiting physicians to Idaho. That's just the way it is. We've had 3 different hospitals in the last year have to close their labor and delivery services for a variety of reasons. Some directly related to the abortion law and physicians feeling like they just were too at risk to practice freely here. Others that were a combination of the abortion laws, then also the fact that Medicaid doesn't reimburse at a level that makes it financially viable to carry labor and delivery services if you don't have a large volume. So, it might not just be one specific thing, but when you add all of those together, we are, our most recent meeting with our hospital folks, we went around the room and asked how things were going. And down in Southeast Idaho, almost every single hospital talked about what a difficult time they're having recruiting particularly OBGYNs, but also pediatricians. Um, and some of them had openings that had been open. They had been actively trying to recruit for more than a year and a half to get a doctor to come to their hospital. And in some cases, one told me 9 months and they didn't even get anyone to do a site visit, let alone find the right match for their community. So, this is not exaggeration. I think it would be an exaggeration to say all of the doctors are fleeing because of one specific law. But it is true to say that law is making it more difficult, add on to all of these other issues, is making it very difficult to. I'm sorry, phones are ringing all around. I apologize for that.
You're fine. You're fine. No, I am. I originally was concerned that I was teeing you up as the healthcare expert and you were gonna break under the pressure. But as promised, Toni, very well said. Whatever the reason may be, the fact of the matter is Idahoans are having a difficulty getting doctors in, and when it comes time to delivering babies, you need someone to do that. And so you say all the above to be able to fix this. So we're talking. We look.
Talk about market factors, and Republicans like to talk about free market. And what does the market fact? What does the market say? Well, the truth is, Idaho, the way we operate this day and age, we are in a national market. We have to compete nationally. We are trying to recruit nationally to Idaho. So if one state over, the situation is just a little bit better, then we're going to lose out. We used to be able to say, well, our cost of living is much lower and our quality of life is better. And we get top physicians to come to Idaho, even though we don't pay as much or we don't have those things. But our cost of living is not really that much better anymore. Our housing market's not better. Quality of life's still awesome. But it's that little advantage here and there just is we're losing out.
So as you look at solutions of things that can be done, I know you've got a playbook. I know as you meet with your hospitals and you talk about attracting physicians to these communities, you mentioned a few of them already. One of the things that Representative Wheeler's doing, another looking at rural doctors being able to pay off and loan forgiveness. Other things that creative solutions that we may not be aware of that can help change the tides. Certainly there might be some policy fixes to laws.
Yeah, and I mean, and I'll just say this and we'll get off abortion here, but there are some policy solutions to the situation with our abortion laws. And the solutions are not to reverse, the main purpose of Idaho's abortion laws, but they are solutions that add to the clarity for practicing physicians on the parts that put them at risk. So instead of having to have an attorney on call 24/7, if you're dealing with high risk pregnancies, you're able to operate in a space comfortably. So there are some policy solutions that talk about health and well-being of the mother versus life of the mother, that we think these are pretty simple solutions that really don't do away with the overall purpose of Idaho's abortion laws. Some of the other things that we're looking at, telemedicine, and how do we kind of take advantage of providers in one location and let them work in multiple locations around the state. Idaho has actually been pretty innovative in our telemedicine because we needed to. Out of necessity, we've needed to find ways to fill positions. There's a little hospital in Arco, Idaho, Lost Rivers Medical Center, that was one of the most innovative hospitals in the country when it came to filling pharmacy positions and keeping their little community pharmacy open, using telemedicine to do that. But we had to change some laws to give them the flexibility to do that. We had to change some rules and allow them to do that. So I think we're constantly looking at ways to kind of stretch what we have already and get rid of or make our rules more flexible. Governor Little has been good in that, in allowing flexibility and trying to do away with the regulatory burden, but there's still some room to go there. We also see in Idaho, our hospitals are collaborating right now in a way I've never seen in all my years. It's pretty amazing. I think, we think a lot about competitors and competing against each other, but little hospitals are looking at sharing a physician and having a physician work at one site 2 days a week and another site 2 days a week. They can't afford to bring one physician in full time, but they could pay for part of that physician, or they're using telemedicine to add to their nursing presence in the hospital. So there are lots of things that we could do if we can just make sure that the regulations stay out of our way.
Yes. So, moral of the story, Idaho hospitals are experiencing some workforce challenges, but just like Idahoans do, there's creative solutions, innovation, and collaboration that's meeting the challenge.
Yeah, and we're just asking, don't make it more difficult for us. It's already hard enough.
Yeah.
When this new
Well,
batch of legislators come in, we really want to talk to them about, let us help you understand the current situation. Some of you have ideas on how to fix things, but first let's talk about what the reality is before we come up with the fix.
and that's, I mean, that's the key part of what you do for the hospitals is being able to communicate to the policymakers kind of what the facts are and the situations are. So as we go from a controversial topic of abortion, we go to an almost as controversial topic of Medicaid and Medicaid expansion in Idaho. That's one that the temperature in the room has really been turned up over. Senator Cook has talked to us a lot in the past as he's dug into those numbers and the funding and has given us some of the backstory. But it's still unclear as to what the legislature in Idaho is going to do when it comes to the issue of Medicaid. A lot of items being threatened of repeal and moving it and changing some of the requirements you talk about on a federal level. What do you expect is going to happen in this upcoming session with Medicaid?
Well, unfortunately, I expect, from my perspective and from my organization's perspective, I expect that we're going to see a challenge to Medicaid expansion. I expect we're going to see an attempt to repeal Medicaid expansion. And I think that would be unfortunate for a few reasons. First and foremost, this is initiatives that the voters overwhelmingly approved in Idaho, in almost every county, except for just a handful of counties. Every county approved it by pretty significant margins. And the other thing that I think, especially new legislators or legislators that haven't been there quite as long, what they're failing to take into account are the long-term savings that we're seeing right now because Medicaid expansion went into place. We've been seeing ongoing savings in the Department of Corrections, ongoing savings in our behavioral health services program, ongoing savings at the county level, the state catastrophic fund. And I think when you drop in now and look at the budget, you don't have that context and history that shows if we were to repeal Medicaid expansion right now, when Medicaid expansion came in, we got rid of a lot of safety net programs for people who were uninsured or had catastrophic situations or illnesses. We got rid of all those because we could put those folks on Medicaid expansion. If we just do away with Medicaid expansion and there's no plan to backfill that safety net, that is going to be bad for individuals who don't have access to care. It's going to be bad for our hospitals who end up, we're mandated to treat anyone that shows up in the emergency room, whether they have the ability to pay or not. And so for some of those folks who don't have Medicaid, would no longer qualify for Medicaid expansion, don't have insurance, it just means that that local hospital is just going to have to eat those costs. And they're not in a position right now that they can significantly increase the level of unreimbursed care that they take. So I hope that before, particularly the new legislators look at repealing Medicaid expansion, they have some conversation with folks that have been around for a while, and learn more about all the places we've been saving money because of Medicaid expansion.
Yeah, so the argument that Medicaid expansion must be repealed because we're going to bankrupt the state, as we've heard in the past. Your argument is no, we're actually saving the state lots of money, and
We
once
actually are, and
yeah,
I'm sorry, the bankrupting the state, that argument's a little bit difficult to take when I think I just looked at the new economic report, the budget report, and we're about $100 million ahead of where they thought we would be at this time when they set the amounts last session. So it's hard to argue bankruptcy when we're $100 million ahead of where we expected to be. Do we have to look at costs? Absolutely. Do costs increase? Absolutely. But look at the cost of Medicaid and how it's increasing compared to the rate of increase in education, Department of Corrections, other agencies and their rate of increase. I think the rate of increase for Medicaid has been exaggerated. And I think part of it is because people get confused with what the state federal or the state general fund dollars are, what Idaho is coming out of Idaho's general fund, and what's coming out of federal dollars that are available to the state. And people tend to lump those all together, and it makes it sound like, the Medicaid budget is hugely, you know, taking over and squeezing out the education budget, for example. Well, the education budget is still, twice the size of the Medicaid budget, and the rate of increase is comparable. So I just think there's a lot of, you can slice and dice those numbers in a lot of different ways, but I kind of wish that we'd refer to, when we're talking about the Idaho budget, we'd refer to the Idaho numbers.
Fair. And we need to do just an episode just on Medicaid, right? I think the average Idahoan probably doesn't understand the difference between Medicaid and Medicare, and that's okay. That until you're using it, it's hard to understand it. But those policies matter. Your taxes are going towards them. It's a big chunk of your taxes. So these issues do matter. And to your point, they affect not just those who use a hospital for their health care, but those who are employed by a hospital and need to make the budgets work at the end of the day.
And I think, there is a very good argument to be made that Medicaid expansion really is the more fiscally responsible program compared to what we were doing before Medicaid expansion. We were sinking money into county indigent programs. We were sinking money into catastrophic care, no preemptive or preventative care. We were, sinking money into the corrections program. So if you look at how to spend your money and where to spend your money, it makes fiscal sense to do Medicaid expansion over spending in all these other areas that's not coordinated and doesn't increase access to care.
Yeah. Toni, I had a list a mile long of all the questions that I wanted to ask you, and we got through only a couple of them. And so I know, busy are, and that you've got to run, but time flies. As we wrap up here, I want you, as somebody who, again, has a very unique perspective when it comes to hospitals. For those of us that don't put on the scrubs and those of us that are not involved in a hospital until it's actually for care, we sit on the other side of that issue. What is something that the average Idahoan needs to understand about the hospitals in our state that you are so grateful you sit in a position that you do understand?
Oh, every day, honestly, I love my job because I get to work with the most amazing people who do nothing more than think, how do we make sure our community has access to care? How do we care for patients? I think what most folks don't understand is the collaboration that's taking place between hospitals and individual providers and other entities. I don't know that people realize how dedicated their small hospital folks are in particular. Let me give you one quick example. I had an issue that I've been dealing with a little hospital up in Grangeville, and I needed to call him and ask him for some data. And I called the CEO and I said, I need this data. There's a hearing next week. I need your information. Can you get this to me? He said, well, I can't get it to you right now. I'm in Alaska for my daughter's wedding, and I don't have access to it here. But if you give me until midnight tonight, I can get it to you. And I said, stop. It's your daughter's wedding. I will get this information somehow. You are on vacation. Don't worry about it. He said, I'm a hospital administrator. I never go on vacation. And that's just his attitude toward life. He is on call 24/7, whether he's in Idaho or Alaska. he is still working on how to make his little hospital viable and make sure that they can provide services to their community. I wish folks could see the dedication I see every day, at all levels. It's for me really inspiring.
I love that. And I too am inspired. It's heartwarming to hear about the collaboration that's going on between hospitals in Idaho. I think there's a big difference in the challenges that some of our largest hospitals are experiencing, some of our rural hospitals. We didn't get into, proposals that would affect property tax exemption with hospitals, but we will. As the legislature comes back, and you mentioned you've got a lot of informing and educating to do to help our policymakers know what's going on. We'd love to have you back and talk about those
Right.
issues.
Can I just say one thing about small hospitals and big hospitals?
Please.
We often talk about rural hospitals and then we talk about big hospitals, and as if they're such different beasts, and they are very different. But in Idaho, I like to tell people that big hospital is your local hospital. Even if you live in Soda Springs, that big hospital in Pocatello or Idaho Falls is also your local hospital, because these small critical access hospitals really couldn't provide all the services you need without collaborating with larger hospitals. They can't provide the cancer care, they can't provide the trauma care, they can't provide the specialized care that you need. And to do that, they collaborate and partner with large hospitals. So when I work particularly with rural hospitals, I have a real passion for rural healthcare. I recognize without our large hospitals in a strong position, in a very stable and fiscally sound position, our little hospitals would have nowhere to go. So I want to make sure people understand they're connected. We
Yeah.
can't hurt big hospitals and not hurt little hospitals.
Yeah, that's a good point, because we know we've all had the aunt that lives in rural Idaho who has to travel to get, the hip or the knee replaced, even though, her general doctor is just up the road on Main Street of that small little town. So good point. So are you more hopeful about the future of healthcare in Idaho than you are concerned?
I'm always hopeful and inspired, but I got to be honest, I'm really concerned right now. There's a lot going on. Our little hospitals, particularly, are in a pretty precarious situation. Our larger hospitals are struggling in some areas. Some of them are at the point they might have to look at cutting specific service lines. I have one hospital right now that if things don't turn around, they're probably going to have to cut their behavioral health services. Idaho cannot afford to lose any behavioral health services. So I'm always inspired and know our folks are doing everything they can, but I'm really concerned right now about the fragility of the system, and how any change, while hopefully the change is good and helpful, but any negative change could really have a very strong impact on folks that are just kind of trying to keep their head above water right now.
So,
I
so
hate to
Toni,
be negative. I like to be positive, but I'm really concerned right now.
what's the call to action to those listening who don't want to see their hospitals struggle? Is there something they can do to get involved or better get informed? Do you have an education arm over there at the association, or something they can do?
For a lot of folks, their local hospital is a public hospital. I would encourage you to stay informed of what they're doing. They put out newsletters, they put out information, they have a lot of educational sessions that they do at their local hospital. If you're a lawmaker, a policymaker, I would say please reach out to your local hospital and ask them, how does this proposal impact you? What happens here? How can I help? And just really try to understand what the process looks like and what goes into keeping your little hospitals open. In particular, what goes into strengthening healthcare or making it more difficult? Because if these services close, it's not just going to be small communities that suffer. We're going to see backlogs everywhere. When that local hospital closes in a small town, those patients have to go somewhere. They're going to go to a larger facility, which is now going to struggle with capacity issues and struggle to recruit. We're all connected here. And I really would, instead of listening to rumors and lots of things, just try to find the facts out for yourselves. Talk to your local hospital, look at their websites, look at their announcements. There's a lot of information on their websites that people aren't aware of. A lot of information on what they're doing for the community, what kind of charity programs they're doing, what kind of community benefit programs they're doing. I think hospitals are much more integrated into their communities than people realize. And a lot of smaller organizations are reliant on their hospitals to support. So I just really encourage you to, look at your hospital and talk to the folks there and find out what they're doing.
Sage advice from a veteran in healthcare advocacy. Toni, you've been fantastic.
Yeah, and I can tell you, in our Idaho Hospital Association website, we have a document called Hospitals 101, which is a pretty good resource. It kind of talks about the different types of hospitals, how they're funded, what Medicaid is, what Medicare is, a lot of kind of public health issues, public policy. It's kind of a general, overview of healthcare, in particular how it relates to hospitals. So if people want that general information, the Idaho Hospital Association website has that open to the public.
Perfect. We're going to send them there. This has been great. I still wish we had another hour to do this. Toni, you're going to come back, right? You promise?
Absolutely. If I
Okay,
didn't
we're
bore
gonna
you
get into
enough
it.
today, I'll do it another day.
I'm fascinated. The hospitals are the thing that we don't think about enough, and maybe that's a good thing we don't think about enough. It means you and your folks are doing their jobs.
We
but
just
it's
always expect they'll be there, but there's a lot that goes into making sure they're there for you 24/7.
I love it. Toni, thanks again for all the good work you're doing. We'll look
Thank
forward to having
you.
you back. Okay, till next time.